Hello, Andrew Colsky here with Therapy BTS, Therapy Behind the Scenes. We are going to be talking about sleep today. My guest is Gilles Frydman, who is the Executive Director of the American Sleep Apnea Association. And we're going to be talking about not only what they do, but what's coming in the future with sleep and sleep medicine and sleep apnea. So, Gilles, welcome to the show.
Thank you for having me on your show.
Thanks. So tell us, as the executive director of American Sleep Apnea Association, what does the association do?
So the association is maybe and probably the largest national organization that is a patient advocacy organization for people suffering from sleep apnea.
Mm-hmm.
It's an old organization. For the first 15, 17 years, it was driven by doctors. And for the last 13 years, it is a patient-driven, patient-centered organization. Sleep apnea, sleep medicine is one of the newest specialty in medicine. It's still in its infancy, and it is exceptionally paternalistic.
Mm-hmm.
Before joining the organization, I created and managed an organization that built and managed over 200 online communities for cancer patients.
Wow.
And we did this exactly at the time when oncology moved from being a side of medicine where you treated people with known recipes without really understanding what was the science behind it, into the era of targeted therapies, where those therapies were designed specifically to deal with specific mutations, with the geometry of specific mutations. And all of a sudden, there was like a huge amount of science that was pushed into oncology.
Mm-hmm.
And it happened at the time when the internet was born, and oncology changed radically. First, because we and many others built huge communities of cancer patients, very specifically for diseases. And we became directly involved in making sure that the latest science was available to patients so they could make informed choices. And the field of oncology understood pretty fast the value of having the voice of patients involved in science. And if you go to the ASCO meetings today, which are like huge meetings with 50,000 people,
Mm-hmm.
you cannot have some of the important panels without patient representation, without having patients that come and talk about their experience and what they know about the science.
Right.
As a result, oncology is infinitely better than it was. And accelerate discoveries really significantly.
Mm-hmm.
Sleep medicine is not there at all. There's been no patient representation at their yearly meeting until 2 years ago. And there is, I can say, to this day, there is no patient representation there. I mean, they invited executive directors of organizations to come and talk about the organization, but that's not what patient representation should be. In all the big panels talking about the science and the clinical discoveries related to sleep medicine, there should be patients coming to talk about their experience and how the science and the clinical developments relate to the real life experience of people. We're not there yet at all.
Right. No.
So sleep medicine is, for its short history, it has focused exclusively on the definition, identification, and treatment of sleep problems. And by doing so, it has kept sleep science and sleep medicine within its own bubble.
Mm-hmm.
It has copied the old model of American medicine, focusing on disorders, disease, and their treatment. Sleep health, at the opposite, which is where we are now going to put a lot of our focus, provides a positive frame of reference for sleep. It's not simply the absence of sleep problems, but rather an indicator of how well an individual and populations is doing.
Mm-hmm.
Sleep health can serve an important educational function. I'm sorry, I have to read this because
Yeah. No. This is great.
it can help people to understand what is considered to be normal sleep and how to improve their sleep habits. Sleep health can provide concrete targets for health promotions and prevention activities. And prevention medicine should become much more important than it is.
Mm-hmm.
This is in contrast to treatments for disorder, which focus on the removal of symptoms or dysfunction.
Yeah.
If people understood what the significance of sleep early on in their life, they would change many of the ways they live their life.
Right.
If they understood how profoundly fundamental sleep is, they would pay attention. But no one has told them that sleep is one of the three vital pillars of health,
Mm-hmm.
together with nutrition and movement.
Mm-hmm.
And in reality, I think it is the most important one, because you can live for a very, very long time without doing any kind of exercise. You can live for over a month without having any food. And most people cannot live for a month without sleeping. Within 3 days, you are completely dysfunctional.
Right.
And
Right.
many people within a week will pass away.
Wow.
So, yeah.
Well, it's really interesting to me what you're saying. And the reason why it's so interesting to me is because, I'm approaching sleep from a mental health perspective. And learning about it, just like you say, it is in its infancy. And
Mhm.
I was searching for other mental health professionals that specifically treat sleep disorders like insomnia and things from a mental health perspective. And there was, I think I came across 4 or 5 listings in the country from what I was looking for.
Yeah.
And, just what you're saying here in terms of there's a lot of different disorders. Like, for example, I do a lot of work with OCD. And with OCD, there's the mental health side and there's the medical side, but they have to work together to be able to give the proper, treatments. With sleep, when you hear sleep apnea, you hear, oh, you've got to be a licensed doctor, medical professional to treat sleep apnea. Well, that's okay from the medicine end. Sure, I get that. But it's like you said, it's missing the patient end. And I think that there's
Absolutely.
this need for the combination of both fields to be working, together to make progress.
How many doctors in general practitioners have ever asked you a single question about how you sleep?
Oh, none, none. It's not an issue.
Okay. Um, so sleep health also can tie in with broader agendas, which I think is very important, such as improving population health.
Mm-hmm.
And finally, studying individuals with a wide range of sleep health can be useful for sleep research. So I think when it comes to sleep apnea, the numbers of people suffering sleep apnea is one of the two big disorders, sleep disorders, sleep apnea and insomnia. In reality, many people with sleep apnea also suffer from insomnia and a variety of other disorders. But if you do not explain to people what sleep is and what normal sleep is, it's very difficult to explain to them what is the significance of sleep apnea.
Mm-hmm.
If you sleep apnea creates disordered sleep due to issues of breathing, right? So many of the specialists of sleep apnea are pulmonologists, which is very good. But the reality is that disordered sleep will affect all the networks that you have in your system.
Mm-hmm.
You have to think of your body as a very complex network of networks.
Right.
Everything in your body is connecting with other things, and it's sending signals from here and receiving signals from there. When you have disordered sleep, a lot of this communication gets broken. You have a whole bunch of inflammation in your body, so it has profound influence on cardiovascular health, which is why, as of this year, like a few months ago, the American Heart Association added sleep as one of the 8 pillars of cardiac health, cardiovascular health.
Mm-hmm.
But in reality, it's more important than this. The good thing is that there is now an explosion of research related to sleep. And so you have to get out of the world of sleep medicine if you want to have a full vision of the significance of sleep, surprisingly. It is fundamentally connected with, I mean, really a wide range of cardiovascular issues. The majority of people, so there is an epidemic of atrial fibrillation in this country, which is due to a bunch of factors, including obesity and diabetes and sleep apnea. So majority of people who suffer from atrial fibrillation also have sleep apnea. The connection, many researchers are working on it. The connection is pretty clear. The reasons are not yet completely clear. But I can guarantee you that even though the American Heart Association published this paper a few months ago, and in 2021 already put a statement paper about the role of sleep in cardiovascular issues with a whole section on sleep apnea, the vast majority of cardiologists, together with almost all GPs, will never ask a single question about sleep to their patients that have atrial fibrillation. And if you know the statistics, if you have atrial fibrillation and sleep apnea, your risk of having an untreated sleep apnea, your risk of having a stroke within 5 years is 6 times higher.
Wow. Wow.
So to me, considering the number of people that have sleep apnea, which is between 30 and 50 million people in America, and the number of people that suffer from cardiovascular issues, it's unthinkable. Why don't all cardiologists and all GPs start to ask 1 or 2 questions to their patients? It's not that complicated. Do you snore? Do you wake up refreshed?
Yeah.
So cardiovascular is one issue. It's definitely connected with obesity and diabetes. It's definitely connected with a huge range of cognitive issues. Alzheimer's disease, Parkinson's disease. And it's becoming clear that it's also pretty clearly associated with mental health issues.
Yeah. Well, it's,
So,
it's and all of this that you're saying is right along with something that is an emerging issue that we as the whole community have not put a lot of attention into. And it's really interesting, I'll share with you from my end. I've been speaking with a lot of different sleep doctors out there and people who are involved with sleep apnea testing. And one of the things that I talk to them about is not only the actual technical part of sleep apnea and the testing and all that, which is important and that's emerging. But then I say to them, well, what happens when you have a patient and they don't have sleep apnea, but they have insomnia, or maybe they have sleep apnea and insomnia? What do you do with those patients? And universally, the answer is, oh, we give them a sheet about sleep health and we send them on their way. There's nothing, it's just sort of dropped. And
sure,
that's kind of what you're saying, that we don't have the whole big picture.
absolutely. And because it's mostly a business. So you diagnosed a person, you prescribe a machine or some other device, and then you send people home. And there is absolutely no follow-up from the medical world.
Right.
Can you imagine if you get diagnosed with diabetes, you get prescribed and you're prescribed a device? Can you imagine no support at all after that? That's unthinkable in the world of diabetes.
Right. But
if you stop being compliant, someone is going to call you and say, like, come on, like, what's wrong with you? If you're not compliant with your use of a CPAP machine, Medicare will come and pick up the machine that they gave you. They won't provide you the services necessary to make you getting used to a totally different way of sleeping.
Right.
Which explains, since you get provided this machine, which is going to like really completely change your sleep environment and how you sleep, most people try to use it, and then without the support, they stop using it. And because they stop using it, CMS has decided there is a rule, which is a very strange rule, which says that patients have to use the machine more than 4 hours during an uninterrupted 21 days period within 30 days, within the first 90 days. I don't know who came up with this concept, but I mean, okay. And so if the patients do not follow that rule, which they're never told about, by the way,
Wow.
Medicare will come and pick up the machine.
Wow.
And
That's,
goodbye. And that's it. That's the end of your treatment for sleep apnea, which will definitely shorten your life or kill you.
mhm.
And I mean, untreated sleep apnea, especially if it's of a severe form, will shorten your life by years and will make you lose your memory, will have profound consequences on cognitive issues. I refused to accept the fact that I had sleep apnea for many years, and as a result, I have refractory high blood pressure.
Hmm.
But I'm one of millions of people that have this issue.
Right. Right.
So I mean, really, it's a disorder that will affect all the networks in your body. So depending on your genetics and epigenetics and other factors, it will attack specific networks in somebody and will touch others in somebody else.
Right.
One issue that we have to mention, you and me are both white people,
Mhm.
but there is a very large overrepresentation of sleep apnea among minorities. One of the reasons is that there is a huge overrepresentation of minorities in shift work. And shift work is known to have very nasty influence on sleep apnea.
Oh, wow. I,
Yes.
I I can understand how it has, impact on insomnia, but I was not aware about the sleep apnea link.
Mm-hmm. Sure. And if you want to see systemic racism in action, if you want to have an immediate visual representation of systemic racism, you go to Google and you type the following: sleep apnea patient. And when you're there, you click on images. And the screen that you're going to get will speak louder than any words I can give you.
Wow.
Almost all the images are older white males.
Wow.
How are you going to convince a black man that he should use a machine that is going to have a really profound influence in his bedroom, that he should use a machine if he can't find anybody that looks like him using it?
Wow. Well, that's, that speaks to what you're saying is the amount of additional education that has to get out there, the amount of, uh, working together, mental health and physical health professionals, but the real problem, one of the real problems is if you try to get, as a patient, if you try to get a sleep study or you try to get in to see a sleep doctor, they don't have room, they're packed. So their argument is going to be, we don't have the time to follow up with people because we can't keep up with the number of new people that are coming in. And,
Sure.
because there is a shortage, from what I understand, a great shortage of both medical and mental health people who deal with sleep.
Mm-hmm.
And, you know, in school, like in my school, in my training, we didn't talk about sleep. That wasn't part of mental health. Um, and then I've been, doing a lot of my own personal reading and looking at how different sleep disorders are defined in the different types of manuals. And for the sleep community, it's interesting because as you read about the sleep disorders, they talk about which medication to use. It's very focused on a medical response, but there's
That's
missing
it.
the bigger picture of the whole person.
That's it. And as long as you don't understand the science, it's
Mhm.
going to remain this.
Yeah.
How many of the sleep medicine doctors know anything about how sleep impacts memory? What do we know about the genetics and the chemistry behind sleep functioning to imprint memory in your brain?
Mhm.
So I guarantee you, very, very, very few will know anything about it.
Right. Right.
But if you don't understand this, it becomes already almost impossible to understand how sleep impacts mental health. And memory is just one aspect of it. I mean, it's a very important aspect of how the brain works, but it's
Mhm.
just one aspect.
Mm-hmm.
So
It is, it's really interesting to me just as I do my own reading and learning about the field, how much of what you're saying is so important and so true. But, you know, you're right, we're at the very beginning stages. And I love the direction that you're talking about taking the association to be able to start catching up with what, is going to be, I think, more effective in the long term, because it is such a missing piece of the puzzle. So, but
uh,
how do you do
it's a
that?
missing it's a missing piece of the puzzle for one very good reason. Sleep is invisible,
Mm,
right? Do you know
right.
anything about your sleep? You don't.
No,
If you
because
do
I'm
not,
asleep when I'm doing
sure,
it.
if you do not have the right tools, you will never be able to understand what sleep is. So thankfully, technology is coming now with an explosion of devices.
Yes.
All the, I mean, wearables, which are not there yet, will soon have clinical grade, and
Hmm.
then we'll be able to collect data that is going to be both uh, very useful to increase significantly what we know about the science of sleep, as well as understand how sleep impacts us personally.
Yeah. Yeah. No, it's,
And
you know, I incorporate that conversation now into a lot of my mental health clients. I ask them about their sleep. We talk about, sleep health, and it's an important thing. I never asked about it before, and nobody ever trained me that it was an important question. Now I'm
of
learning
course,
it's an important question.
it's a fundamental question, not important, it's fundamental. I mean,
Sure.
when I was dealing with oncology, believe me, I never thought about sleep, but it was my mistake. I mean, there was nothing that made us think about sleep until recently.
Hmm.
The good thing is that I see that there is an explosion of research now. So I'm pretty certain we're going to see an increase about what we know about sleep and its real significance. And probably 5, 10 years, what most doctors think about sleep will be very different than what they are thinking about it now.
Right. Right.
And hopefully most of the public will also start to think about sleep and say it is something really important and I need to pay attention to it.
Hmm.
Um, Coming back to you ask me what the association is doing. So the association has two big programs which are designed to help people who cannot afford to buy machines at the regular price.
Hmm.
So anybody who has an issue knows that they need to have a CPAP machine but can't afford it should go to sleephealth.org, look for the CAP program, and then they'll get in touch with us and we'll help them get a machine.
Oh, wow.
It's not free, but I mean, it's very significantly cheaper than any other way of getting a machine.
Wow.
And we are building services, support services for patients so that when they are prescribed this machine, there is somebody that can help them answer the question that they have because they will have a disturbance in their regular way of getting into sleep
Hmm.
and getting a mask on. I mean, there are many issues. You have different kinds of masks. They don't all fit you for a variety of reasons, depending on how you sleep, the morphology you have, and uh, and we have people that can help answer many of those questions. We are not clinicians, but we can definitely I mean, we have peer mentors, which are other patients, other people with sleep apnea that have understood exactly how important it is to follow the use of those CPAP machines or whatever other treatment. It's mostly, I mean, the gold standard remains to this day the CPAP machine,
Mhm.
PAP machine. Some people have CPAP or BiPAP or APAP or
Yeah,
uh, that's really the big. These are the big programs that we have.
that's fantastic. In terms of education about sleep issues, that's something I think that's an additional piece of that a lot of different organizations could be putting in ways to try and get more information out there. I mean, that's why I'm doing the podcast, is trying
Sure,
to get
of
information
course.
out there. Perhaps you've got me thinking, perhaps there's a need from a mental health perspective to even talk about supporting those people who are starting with CPAP machines or some other treatment, because if they have nowhere to go, and it's great that you have a peer to peer program, that's one wonderful way of approaching it. But think of all the people out there who are not aware of that or have additional issues that come up and they're seeing a mental health counselor. They could be getting additional support there to help them
Sure.
stay with their therapy and adjust to that new change. I use a CPAP myself. I have sleep apnea. And so
So
I've
do you remember the first few days or first few weeks with the
Yeah,
machine?
this hose, and I'm trying to figure out how do I sleep, and I'm getting tangled
Yes.
up in the hose. Yeah, I definitely
Yeah.
remember.
Did you stop using it for a little while after you started?
I was good about it. I knew that I needed to use it because I understood what you're describing as the problems if you don't. So I knew I had to adjust. But yeah, it takes some time because you got this hose and you're afraid that you're gonna like wrap yourself up in it or something when you toss and turn.
Yeah. Can you imagine sleeping without it now?
Oh no, if I sleep without it, I don't get real sleep. I know that I need to put it on.
And I mean, we both use our brains. That's what our jobs are.
Hmm.
I mean, if you don't use the CPAP machine within a day, your brain is not going to function properly, right?
Well, I get accused of that even when I use the machine. but but no, I got you. Yeah, I have tried, because if the power goes out, I'm not using the machine, obviously, because I don't have any power. Um, if I travel, sometimes there's no plug close enough
Yes,
that I can plug the machine in. I try to travel with an extension cord now, but there have been
yes,
times that I haven't been able to use the machine, and I definitely don't wake up as rested as I would be with the machine.
yeah. Not long ago, I went to a conference in Washington, and I made the mistake of taking my machine. I have a travel machine, so I took it without checking it, and it turns out that there was a little hole in the tube
Ah,
between the machine and the mask, which made basically the machine. I mean, I couldn't sleep well. I mean, basically, I didn't get the pressure I'm supposed to get. And really, the first day I was okay. The second day of the conference, I was not okay. My brain was not, really not functioning.
mhm.
And after you've like learned to use this machine, we now know what it is, how our brain is supposed to work. And
Mhm.
any interruption is really disturbing.
Yes. Wow.
Yeah.
So
So
so so for you, in terms of the association, are the members both medical professionals and individuals with sleep apnea? Who is your membership?
patients. I mean,
Patients.
we focus on patients, except that we are doing a lot of research. We're getting involved in more and more research. Uh, I'm a scientist at heart. I studied animal biology, and I want to make sure that like whatever patient organization I help manage is both a producer and a uh, disseminator of science.
Hmm. And so,
I think it's exceptionally important in terms of like as it relates to sleep because there are so many uh, pages on the internet that are trying to sell you like snake oil and products and I mean all this stuff that really don't work at all.
right. No, that has always been the case and always will be the case, I think.
Sure.
But it
But
is
it's not that complicated to help people get access to reputable information.
right, right. And it's exciting that we are at this sort of dawning of the new information about sleep and the technology advances of things that are truly, could be meaningful and helpful to get people the types of help that they need. And, perhaps more and more practitioners will be trained to be able to address these issues and at least be aware of the issues.
Well, so practitioners should definitely become aware of some of those issues, but I think that the patients have a huge role too.
Hmm.
I think that this time of really paternalistic medicine, where you're being told do this and that's it, is over. So, with the advent of all the wearables, we can help educate a lot of people about the essentials of sleep and sleep science, so they understand what it is, and then show them what are the tools that are available for them to start measuring what's happening during this invisible period of time.
Hmm.
And if you measure it and you look at it, you can understand what's happening to you.
Right,
You
right.
don't always need to have the presence of a clinician to improve your health. In fact, I think the majority of the time, it's on you.
Yeah. But then that comes back to what you're saying is being able to get reliable, valid, evidence-based information that is going to be, useful and meaningful. And
Sure.
that's where you have to filter through all the different things you might read on the internet.
Yes. I spent a lot of time in a little mountain town in Colombia, which is famous in Colombia for being the place with the largest proportion of centenarians.
Hmm.
And most of them don't spend a lot of time in the medical environment. It's their way of life that makes them live so long.
Right. Right.
And so I think that in our like over technology world, we always think that like everything needs to be done with technology and with clinicians. I'm telling you, a lot of things can be done in terms of preventive medicine in just the way you live.
Right. Yeah. No question about that. But
So
these are, like you said, this requires the individual to make that decision for themselves and then educate themselves and then follow through. And
sure. Yeah.
that's challenging for some people sometimes. So,
So we almost started this conversation where you said that you work with a lot of people with OCD.
mhm.
Do you know that a lot of people with OCD also have sleep apnea?
I didn't know that. I'm just starting to learn the connection between sleep and all
Yeah.
these things.
Uh-huh.
So,
In this case, it's really specifically sleep apnea.
really,
I was reading about it just like 2, 3 days ago. Yes.
that's really interesting. I need to read up more about that because yeah, I had an interesting conversation with another sleep apnea professional, and she did a presentation on the podcast here, and she talked about just describing sleep apnea, but also looking at certain characteristics and data and things about people with sleep apnea. It was really, really interesting and informative, and I'm glad I have it up as a podcast because I learned a lot from her just about that.
Yeah.
So,
Sure.
yeah, it's a really interesting area, and I guess maybe some people would think that sleep may not be interesting to them, but when you get into it, it actually is pretty interesting.
Uh, just the same, many people think that nutrition is not important to them, but they're all mistaken.
Right,
So
right,
many people don't think that sleep is important to them. They're all mistaken.
right. No, those are all kind of like standard parts of my conversation with my patients now. We talk about what they're eating, we talk about their sleep, we talk about, any habits of different things because you're not just treating what they come in for. You've got to treat the whole person because the whole
Of course.
person is what matters. And
And when it comes to sleep, it's 1/3 of your life.
yeah,
And the fact that it's invisible makes it much more difficult for people to like really think about it. But it's 1/3 of your life. And if you think that our bodies are designed to have 1/3 of our life where nothing happens, you don't understand how the body works.
right, right.
Yeah.
Well, this is why we have these conversations, and this is why we share this information. And I'm
Yeah.
so glad, that we had this opportunity to talk about this. And it's really interesting because the way you're describing it, and from what I'm seeing as well, I think that this industry is moving really quickly all of a sudden with a lot of new information coming out, and I'm excited to be a part of that and to try and keep up with it. I'm getting ready. Is it just next week? I think I'm doing a mini fellowship at University of Pennsylvania with sleep issues, and I'm excited to learn, about the cutting edge stuff they're doing there. So yeah, there's more and more information coming online, and I encourage people. Well, you know what? If someone wanted to join your association, what's the web address for them?
Sleephealth.org.
Okay, perfect. And they can just sign up, and there's a way for them to join.
Sure. I mean,
Perfect.
this is not a professional organization, so and anybody can join, and it's completely free.
Oh my gosh! Wow, that's even
Yeah,
better.
yes. I mean, and we are in the process of a complete redoing of our website to present exactly what I was saying at the beginning, like with a new, like, clear focus on sleep health.
Hmm.
We,
Wonderful.
I mean, many patient stories have convinced me that we need to do something bigger than what was done until now. We have a former chairperson of our organization whose brother passed away just simply because he had surgery and the anesthesiologist did not ask a question about do you have sleep apnea and gave that person the wrong anesthesia
Oh
that put
God.
that person in like cardiac arrest because it's well known that some types of anesthesia really cannot be given to people with sleep apnea.
Wow.
Yeah,
Wow. That's sad.
that's the reality.
Yeah. Oh my gosh. Well,
So
let's do this. Let's wrap up the podcast, and then hang on a minute, and you and I will talk a little bit more, because maybe there's some more things that I can do to help you in
sure.
spreading the message. So